Hi everyone, and welcome to today's episode of Your Free Consult. If you're not looking to have a baby right now, or maybe you want to space your family a little bit, this episode is for you because we're talking about contraception, so stay tuned. So when we talk about contraception, the very first thing that your gynecologist needs to do is find out your medical eligibility criteria. This is a criteria that we use to see which contraceptive works for you. We don't want you to have a medical condition that does not allow you to have a particular contraceptive. So we need to understand your entire medical history, your obstetric history. Have you had babies before? Have you ever had contraception before? And what kind of side effects did you experience on this contraception that could maybe say no to this particular contraception you're wanting to use? Now, other than doing the medical eligibility criteria, I need to tell you that contraception is trial and error. It works for you, you stick with it. It doesn't work for you, you give it a trial period and you get rid of it if it really doesn't work. And there's no one size fits all. There's no contraceptive that works for you just because it worked for your sister or it worked for your cousin. You really need to know what works specifically for you. So we have different types of contraception, both for men and women, and I'll be focusing mainly on women today, but I will give you a little sneak peek into male contraception as well. So for women, we have barrier methods, we have natural methods, we have hormonal methods, and we have surgical methods. Now in the barrier methods, this is actually more or less a male contraceptive because condoms is the main barrier method, but we do have condoms both for male and females. And in barrier methods, we also have foams and creams, but they're not readily available and they're not very effective in terms of not causing pregnancy. Other than barrier methods, we have hormonal methods, which I'm gonna go into depth a little bit later. We also have surgical methods, and in surgical methods, this includes bilateral tubal ligation and vasectomy for men. These are very interesting and I'm going to get into that in a short bit. But we also have natural contraceptive methods, and in these methods we're looking at cervical mucus detection. So women look at their cervical mucus to tell, is it a good day to be able to have sexual intercourse, not to have pregnancy, or is it not a good day? So cervical mucus detection. We also have coitus interruptus, which is also called pull out or withdrawal, and this is a contraceptive method, although it's really not effective. And all safe days, pull out method, cervical mucus, their efficacy is actually quite low and it's very variable, anything between 20 and 65%. And when you choose a contraceptive, you want a contraceptive that's reliable, that has a high efficacy rate, and that does not involve too much work. You don't have to think about it too much, and it just causes contraception for you in a very effective and smooth manner. So natural contraception has a low efficacy, but is used either for religious or cultural reasons, or for women who are completely unable, medically speaking, to have any other contraceptive. Now let's dive into hormonal contraception. So hormonal contraception can either be combined oral contraceptive pills, or progesterone-only contraception, or emergency pills. Now combined oral contraceptive pills are called combined because they have both estrogen and progesterone in small amounts. They're taken daily for 21 days. Then we stop them for 7 days in order to be able to have a period. And they're taken cycle after cycle in that manner, 21-7, 21-7. Now, the advantages of having an oral contraceptive pill is that they're easily reversible. You can stop them at any point to want to get pregnant, and you should be able to get pregnant more or less immediately. They are good for your ovary. They decrease cases of ovarian cancer. But however, they do have a few effects. Weight gain is one of the effects, headaches is one of the effects, mood changes is one of the effects, vaginal infections because they can alter your flora and decrease your immunity. They also have a small risk of breast cancer and non-cancerous breast lumps. They also have a moderate increase in endometrial cancer, and when used over 5 years, they do pose a small risk of cervical cancer as well. They do help your skin, so they're great for acne, and you'll have very many dermatologists prescribing them. But one of the other adverse effects is that they can cause clots in your lower limbs. Some studies have shown that they do cause clots, some studies have shown that they don't, and unfortunately we cannot ignore the studies that have shown that they do cause clots in your lower limb because they increase the clotting of your blood. Now, if any of these clots were to dislodge into either your heart, brain, or lungs, that could be fatal. And so that's some of the reasons why we need to consider oral contraceptive pills very carefully. I do like to give them to my patients who are just starting out with contraception because they're easy to use, but you need to consider the adverse effects and the risks. Now let's move to progesterone contraceptives. We have a progesterone-only pill. This is a pill I like to give mothers who are breastfeeding because it doesn't affect their milk supply, doesn't have estrogen, so it doesn't have any risk for cancer, and it allows them some time to be able to just decide on which more long-term contraceptive they want to use. It's taken every day without a break, but some of the side effects are acne, low libido, vaginal dryness, headaches, abdominal distension and bloating. And so this is maybe not one of the contraceptives that you would want to use if you're not just a lactating mother, but it's great for lactating mothers. It's taken every single day without break, as I mentioned, and many times you may miss your period while on it. How it works is by making you not ovulate, and it also decreases the lining of your uterus such that if ovulation and fertilization happen, then implantation is definitely not going to happen. Amongst the progesterone contraceptives, we also have a progesterone injection. We call it a depot injection. It's either a 2 or 3 monthly injection. I don't like to use it at my clinic because in some countries they don't use it at all and it's banned. So I just feel like if it's banned in the West, it should be banned in our countries as well. However, it does cause contraception. It lasts for about 3 months. One of the side effects is osteoporosis, and that's one of the reasons why I don't like to use it, meaning that it can make your bones weak and can make you prone to fractures, especially if you're very young. The other effects are acne, low libido, vaginal dryness, headaches, weight gain, and sometimes even weight loss. Many women who use it experience no periods at all, and some of them experience erratic periods. It could go for a while, then come back for a few days. You could get spotting, and that's the classic part of progesterone. You always get a bit of erratic bleeding. So the depot is one of the ways that you could have contraception. Another progesterone-only contraceptive is the implant. So it's a small silicone stick. It's inserted at your gynecologist's clinic. It's done under local anesthesia into your upper non-dominant hand. So the insertion isn't painful because we do anesthesia for it to be able to be inserted. It lasts for 3 years. It releases progesterone in small amounts into your body for 3 years. The efficacy is about 99%, and as I mentioned before, it has progesterone side effects like weight gain, weight loss, acne, low libido, vaginal dryness, headaches, and many women actually complain of low libido. Unfortunately, as I mentioned with contraceptives, you will not necessarily be able to tell which effect you'll get. You can get one of the effects, all of the effects, none of the effects, and so it really is trial and error. And if it works for you, stick with it, and if it doesn't work for you, get rid of it. In terms of erratic bleeding, for my patients, I like to observe it initially and see what the pattern of the erratic bleeding is, and if it's manageable, that's fine. But if it gets worse, for the next 3 months we treat the spotting, and after we treat the spotting, 6 months later the patient is able to decide whether or not they want to continue the contraception or not. Another progesterone-based contraception is the hormonal IUD. It releases small amounts of progesterone into your uterus for 5 years. Your gynecologist inserts it in the clinic under no anesthesia, and unfortunately the insertion is painful. The good thing is that the majority of the hormone is trapped inside the uterus, so it's released and kept in the uterus, and this is over 90%, and a very small amount actually goes into your bloodstream. And what this means is that the side effect profile is much less, and the manufacturer reports no weight gain, no acne, no libido changes, although I have had some of my patients report a bit of vaginal dryness and breast tenderness. It's a very effective contraceptive. The manufacturer says it's 99.96% effective, which means that it has the lowest failure rate currently in our market. The removal is also done at your gynecologist clinic, and when insertion is done, they need to do an ultrasound to ensure that it's in the correct position, because IUDs do tend to shift about a little bit. And then every year you're going to do a repeat ultrasound just to ensure that it continues to remain in the correct position. It can cause a little bit of spotting once in a while, and again, as I mentioned with progesterone, we observe the first few months, we treat the next few months, and then the patient is able to make a decision as to whether the progesterone spotting is affecting her life or not. I hope you've understood a little bit about natural contraception, about barrier methods, and some of the hormonal methods. Thank you so much for watching this episode, and next week we're going to talk about the e-pill and male contraception and surgical contraception, so be sure to catch that.